Modern methods allow us to study the genetic and molecular characteristics of tumors in detail, which makes it possible to select the most accurate treatment for the specific characteristics of the patient. This approach, molecular diagnostics and targeted therapy, has given a real chance to improve the prognosis for many patients in recent years. Germany is today among the leaders in the development of new targeted drugs that are already used for patients with lung cancer, breast cancer, melanoma, and a number of other types of cancer. This targeted approach gives patients additional confidence that their treatment will be aimed specifically at the tumor, and not at healthy cells. Unlike chemotherapy, which affects all rapidly dividing cells, targeted drugs target specific signaling pathways or gene mutations that are characteristic of cancer cells. Immunotherapy literally turns on the patient's immune system, setting it up to recognize and destroy cancer cells. The drugs allow the immune system to bypass the defense mechanisms that cancer cells use to disguise themselves. Today, this technique is actively used to treat cancer types such as melanoma, lung cancer, and bladder cancer. The effectiveness of immunotherapy in combination with other methods, such as radiation therapy and chemotherapy, is currently being actively studied. Gene therapy makes it possible to interfere with the genetic code of a tumor in order to block or change the genes responsible for its growth. Gene therapy is already used in several clinics, although it remains a rather expensive and rare method. But we hope that its availability will expand in the coming years. Liquid biopsy makes it possible to detect the slightest traces of cancer cells and their DNA without the need for invasive procedures. This is a real breakthrough for those patients who cannot undergo surgical biopsy or have hard-to-reach tumors. Participation in clinical trials is an opportunity for patients to gain access to the latest methods and drugs that are still being tested. Germany is actively developing its programs and participating in international studies. Artificial intelligence and digitalization have changed the very approach to diagnostics and treatment. Today, artificial intelligence analyzes a huge amount of medical data, helps diagnose, plan individual treatment, and even predict the results of therapy. For example, systems can look for the smallest signs of cancer in images, which makes it much easier to detect tumors at early stages. Moreover, artificial intelligence already helps doctors choose the optimal treatment by analyzing molecular research data and even the patient's genetic characteristics. In the future, we see more opportunities for a combined approach: immunotherapy combined with targeted therapy, radiation therapy, and even gene therapy in various combinations. Such multi-component approaches provide a more powerful effect, since they attack the tumor from several sides.